Well, in News for Your Health, a new study showing that peanut allergies are declining in children up to 3 years old.
And this comes nearly a decade after research first recommended parents introduce peanut products to their children as infants. Internal medicine physician Dr. Lipi joins us now. And Dr. Roy, for kids under 3, there's been a 43% drop in peanut allergies from 2017 to 2020. So what may account for that?
So good to see both of you, and I'm so glad we're talking about this. As you pointed out, there was this recent study published in the medical journal Pediatrics that basically focused on IgE-mediated food allergy, which is the most common common cause of anaphylaxis in children. So this 2015 LEAP study, so that's the Learning Early About Peanut Allergy study, found that physician-diagnosed peanut allergies in children under 3 decreased nearly 40%, and it's based on landmark public health recommendations provided in 2015 that parents introduce peanuts to infants about 4 to 6 months. And just for background for your audience, about 4% of children are affected by an IgE-mediated food allergy. That's allergies from milk, egg, nut, wheats, and that can cause immediate life-threatening reactions, i.e. anaphylaxis. That can include difficulty breathing, swelling of the lips, face, or throat, confusion, loss of consciousness. So I will say, as a doctor, this is really great news, but there's some limitations to the study. But for the most part, this is a very good news in a positive trend.
So my kids were both born after 2015. We introduced around 6 months. So just be specific on the guidelines now. We're seeing this drop. Great news. What are those specific guidelines for when you can introduce the peanuts? Food, peanut butter.
So that's great to hear that about you and your kids there, Natalie. So what the study is saying for now is that, and the recommendation was, and by the way, this is kind of related to the limitation, by the way, and this was pointed out by the lead researcher, Dr. David Hill, which is that there's actually a lack of data on actual infant and toddler feeding patterns, such as when specific foods were introduced, the amount and the frequency of the ingestion following initial introduction. So the specifics were that in this study, what they looked at were introduction of peanuts at an early age, so like 4 to 6 months up to 3. But as for the specifics, talk to your pediatrician in terms of exactly what to do. So because we still don't know which children and how much, but overall, this is good news. But talk to your pediatrician in terms of exactly how much and it's starting when.
Yeah, always consult with your pediatrician, but very encouraging. Dr. Roy, thank you.
Thank you, Dr. Roy.